As we bring in the guy from Sports Medicine Center at Akron Children's Hospital, our good friend for over 25 years here on the morning show, and that's Dr. Joe Congini. Joe, good morning, my friend.
Hi, Ray. How you doing this morning?
I'm doing great. What do you have for us today?
Well, the last couple of days I've been thinking maybe we need to go back and talk about frostbite, but I think it's warming up a little today. Isn't it warming up today?
Yeah, around 70 degrees. Get out and enjoy it.
Yeah, really, it's an important point that I want to make today, Ray, is there's been a lot of talk, and I'm a little torn on understanding this, but I want to try to give it a shot. Is there really is a new approach to soft tissue injuries in the last 5 years or so, but it's really the same things you and I have been talking about for 5 or 10 years here, but they've kind of put a name on it. And so when we're talking about soft tissue injuries, people think ankle sprains the most, and that probably is the most common, but this can be knee contusions, knee injuries, knee sprains. This can be quad and hamstring injuries that swell a lot. And the approach, as we've been talking a lot in the last few years, has been active recovery. And so with active recovery, it's kind of changed what they call the acronym. The acronym that everybody learned back in maybe the late 90s, 2000s was RICE treatment, right, Ray?
Indeed, yeah.
And so I would go, I gave talks at the middle school at St. Hilary, and 6th and 7th and 8th graders understood RICE therapy. And so we went through RICE, and then they added a P, Price. And then in the 2000s, they were calling it actually a thing called police as they changed and research kind of changed. And probably the biggest change came in 2018-19 in this active recovery stuff. And I want to go through it. And the acronym now, it's a little clunky and a little bit confusing, but I still think it has utility to it. Understanding it is called Peace and Love. And so let me explain to you what Peace and Love for acute care of soft tissue injuries. Peace and Love. Peace is in the first day to 3 days. This has been going on since about 2018-19. It got lost a little in the COVID. So peace is the first 3 days. The P is for protect. They like protect better than rest. We're really thinking in an active mindset here, and rest was more lack of use, and we don't want lack of use. We want them using it a bit and getting the muscle pump going to pump out some of that fluid that is actually what causes the problem and slows down the healing for athletes. The E in peace is elevation still. Nobody argues with the research showing that in the first few days, elevating above the level of your heart is important. One big thing I think we've talked about in other areas, but it is mentioned in the acronym of peace, is avoiding anti-inflammatory medicine. So anti-inflammatory medicines probably make things worse early on. And so medicines like Advil, Motrin, Aleve, ibuprofen, we've moved away from those. And I think we've talked about that in certain injuries here. That's the A in peace. C is still compression. Compression plays a good role. But the physical therapists and trainers, you see it all the time, Ray, covering sports and seeing sports. There's different types of taping and a pad with tape under it to push some of that fluid out. Again, the sooner we get the fluid out, the sooner they're going to get moving and the sooner they're going to be on the field. And the fifth letter is E, is education. The athlete needs to take an active role here, and they need to be educated about what you're doing with them. So the first few days, peace, and then we move into the love phase, peace and love. And about day 3, 4, 5 is love stands for L, stands for beginning to load the joint. So in a safe way, we want to start loading the joint because by bearing weight and getting around, loading the joint, we actually, again, push some of the fluid out, get some of those healing factors into the tissue that is injured, and loading is important. O is for optimism. Again, back to the point that athletes need to be, a lot of times they get down, they don't do anything, they stop being active. No, we need them to really be up and understand the program and really working hard at getting rid of this fluid and swelling. The V is for vascularization. This is, I think, a little controversial to me. With vascularization, it means bring the blood flow back there. And I'm always big, and we talk a lot about getting them on an exercise bike day one, getting them into a pool day one, getting them doing things that are active and that bring blood flow to the area, actually, because it's a lot of the factors in the blood flow that help healing begin to occur and speed up the healing. But with vascularization, there's a move away from a lot of ice. Now, this being a little controversial to me with ice for so long, I think ice in the first few days is probably one of the best analgesics we have, especially since we're doing away with anti-inflammatory medicines. So I still use some ice early on, but maybe not as long in the process, and maybe because ice actually decreases the blood flow, and the point of the matter through the research is we want some of those healing factors to get there in a hurry, and so we don't want to use ice for long, maybe the first 24 to 48 hours for reducing pain, analgesic. And the last E is exercise, and get them moving every single day, doing a little bit more exercise, and your soft tissue injuries will do a lot better with this active recovery instead of passive recovery. So things that are kind of going by the wayside, a shorter period of rest, less immobilization. We're getting away from immobilizers and getting away from crutches for very long with these soft tissue injuries. Avoiding the anti-inflammatory medicines. I'm going to stress that again. And this is the active mindset versus the passive, don't do anything. That puts the athletes behind the eight ball. And so this active approach starts immediately after the injury. Once we assess that it's not a bony or a structural injury, we get moving on these soft tissue injuries. And the new acronym that you will see out there, Ray, and they're getting the word out, trainers and physical therapists and sports medicine people, is called Peace and Love. So Rice is out, and peace and love is in.
All right. Joe, great stuff this morning, my friend. Thanks for going step by step with us, and we'll get back together next week. Thank you.
Yeah, we want to keep your audience cutting edge, right? Enjoy the week. Have a great week, and we'll skip we'll skip talking about frostbite for another week, okay?
I hope another year, my friend.
All right, Ray. Have a great week.
You too. Dr. Joe Congini, Akron Children's Hospital Sports Medicine Center, joining us.